What you can do is tell your struggle, tell your story, tell not just the struggles, but also why you do what you do. And your story will be enough for the policymakers. They're the ones that need to understand where the gaps are and to understand what your needs are.
From the USC Leonard Davis School of Gerontology, this is Lessons in Lifespan Health, a podcast about the science and the scientists improving how we live and age. I'm Professor George Shannon, Kevin Shue Chair in Gerontology. On today's episode, how the COVID-19 pandemic is highlighting and exacerbating the burden on family caregivers. We're joined by my fellow faculty member, Professor Donna Benton. Dr. Benton is a clinical psychologist, director of the USC Family Caregiver Support Center, and a member of the Stakeholder Advisory Committee for California Governor Gavin Newsom's Master Plan for Aging. Together, we'll discuss the challenges faced by family caregivers and how they can be addressed at individual, community, state, and national levels. Donna, thanks for being here today.
Oh, thank you, George.
My pleasure. Can you describe who family caregivers are and what they do?
Sure. Rosalind Carter, who was the wife of one of our former presidents, Jimmy Carter, at one time said that the world kind of divides up into four types of people. Those are people who are currently caregivers, those who will be caregivers, those who know a caregiver, or those who will need a caregiver. Now, to be a little more specific about who this caregiver is, it's really that it's us. It's mothers and fathers and grandchildren, spouses, siblings, and often even close friends who help out when we can't do something for ourselves. And that could be at different times, like at say, if we looked at a continuum, sometimes when we get sick, like a cold, we have a family member step in. Well, during that time, they're caring for us, and we could define them as a caregiver. But most people don't think of themselves as a caregiver when it's such a short period of time that you're stepping in. More often, we think of ourselves or could think of ourselves as a caregiver when we are helping somebody who may have more of a chronic illness, so that they may have dementia, which is probably one of the more common things that people think about. So are some memory problems. And we might help with bills in the early stages, or we might do some of the grocery shopping to help clean around the house, just helping to coordinate. But the person is still very independent for the most part, except that you're stepping into helping out. And that's the beginning of what we call a caregiver's journey. At other times, as the journey progresses, you may have to step in more and maybe help with daily tasks like cooking, taking care of the person's laundry. Maybe you have to help them even get dressed or guide them for getting dressed. And so as the disease progresses, you may find that you have more and more responsibilities as what we call a family caregiver. But you're still, at the same time, the daughter, the husband, the spouse, the sibling or a friend. And so what happens is as people take on a caregiving role, they may not see themselves as family caregivers. They see themselves just as what you do because you're a family member. But we call that caregiving. And there are, I don't know, I could obviously, I'm sorry, George, I'm just kind of continuing to talk. So do you mind if I give you a little statistics around caregiving or?
That's fine. Go ahead.
Oh, okay. So in the United States right now, to show you how prevalent caregiving is, between 2015 and 2020, we went from having 4.5 million family caregivers to 53 million caregivers, which is about going from 18% of the population to about 21% of the population is doing some type of caregiving. Either caregiving in the early stages, very light caregiving, monitoring, helping out, all the way to direct hands-on care. And actually, over the years, even more people are caring for more than one person. Almost 24% of Americans. It has been an increase from 18 to 24% of Americans are now caring for even more than one person. And that's because we're living longer in families. So you're more likely to have grandchildren, grandparents, and even great grandparents in a family.
So the idea that we have an aging population, that we're living longer and in many cases healthier lives, that still comes with problems, doesn't it? There are things associated with that longer life that can create a social and family problem, or issues at least, in terms of taking care of these older adults who are in need of, as you said, activities of daily living and instrumental activities of daily living, which are those things that you mentioned in terms of helping with preparing food and even doing mail and banking and things of that nature. What about social isolation among individuals living alone? I mean, what does it look like for a caregiver who is at home alone with a family member?
Yeah, it's interesting because many times when people think about social isolation, you go, oh, well, that only can happen if you're by yourself. But caregivers usually are living with the person they're caring for, or they're going over fairly frequently to help out the person they're caring for. So isolation is going to look different because it can get ignored that the caregiver, they say, well, they've always been there taking care of their mom, their dad, but now this is very different in our pandemic right now because maybe before with their relative, they were able to say you were able to go out and go shopping together. Or you could have somebody else come in, a neighbor could stop by and say, I'm going to go out for a couple of hours. Can you come and sit with mom or dad? And while I go out, well, you can't do that. You can't bring someone into your home comfortably, safely, because now you're putting that person at risk. They probably have some medical condition that makes them at a higher risk for contracting COVID-19. And so the isolation is that the caregiver really can't take what we call respite, which is the ability to take a break and to get away from the caregiving situation. On top of that, for some families, maybe now where before it might have just been two people in the home, for some caregivers, grandchildren or children and adult children have come back. And people are, if they didn't want to end up by themselves in the house, they may now be surrounded by a bunch of people, but we're all surrounded, but we can't really get very close to each other. So you can still feel isolated and alone. So the isolation for caregivers has really changed.
It's interesting what you say, because here we have people who are caregiving for a loved one and who have family members around them at times, and yet they still are socially isolated. How do they get support, especially in today's world where the COVID-19 is running loose on society? How do they get help, support, some way to sustain themselves through this caregiving experience?
Well, pre-COVID and post-COVID, I think it's important that caregivers look for support from both formal agencies that are out there, such as in California, we have the California Caregiver Resource Centers that are serving, just focusing on you, the family caregiver, across the state. So, and now, of course, you can call. So a lot of it starts with a phone call, so that you have someone that you can talk to that understands what you're going through. You now, because of COVID, we're finding more resources where there are telephone support groups, telephone training programs, and of course online. You can find similar support groups and training programs and other ways to connect through social media and through formal programs online for the family caregiver. I think what's difficult, particularly for the online community, is that not everybody has good access to broadband. Um, it may not be in their neighborhood, they may not have purchased it. So while we have a lot of things online, it's really nice to have what I call kind of low tech stuff where you just make a phone call. And so being able to call a central number for the Family Caregiver Resource Centers, which we have here in California, you can start by calling even 1-800-540-4442 so that you can get connected to the right resource center. The other thing is part of that isolation for the family is going to be, during this time, is doing new things to set new traditions while you can't necessarily do your normal things. Maybe you have a new tradition of taking more time to write physically write letters or send more emails to talk to people. Certainly making more phone calls and reaching out and talking to folks. Using your, if you have iPads or some way to visually see someone, I say do that. During this time, I think it's important to also pamper yourself more and spend more time on things that maybe you felt too rushed to do before, but going back and listening to music, finding favorite movies to watch, making meals a little more special. Uh, and right now, particularly for older adults, uh, throughout the state and certainly locally in our city, they're making meals more accessible to everyone because we know you can't necessarily go shopping for you or the person you're caring for. So reaching out to those programs and saying, yes, I want to sign up for a meals program. There are also programs such as meals where you can have a meal and talk with somebody while you're eating. And so you meet somebody new and you have a lunch conversation over a meal together. And this may be somebody that and there's a program online that you can do that. So there are going to be new ways of connecting with people. There are a lot of telephones. They're adding more where people are calling and you can have someone call and just kind of check in on you more regularly and also just have fun conversations. So check with a lot of the resource centers will have information on how to find those programs so that you don't have to be alone and you can hear someone else's voice besides the person you're caring for and maybe some relatives that you talk to regularly. Sometimes it's just nice to talk to someone new. That's when we used to go out and kind of people watch and you got to talk to the person at the grocery store and the pharmacy and just general chit chat with strangers.
There's so much care involved. There's so much mental and physical strain that caregivers have to survive. A question I know when I'm teaching sociology and aging, one of the questions that always comes up is, do family caregivers get paid for the work they do? And in fact, should they? Does that make sense? How do you feel about that?
Thank you, George, for asking that question because our whole healthcare system relies on the fact that the majority of caregivers, of people that are really helping out the healthcare and taking care of people that need lots and lots of hours, up to an additional 80 hours a week of care. Our system really relies on this informal support system. Whether we should get paid for doing that, um, I think that there certainly is an argument for that. But I don't think we certainly could not afford it as a country to pay everybody for care, for child care, for helping older adults. So there's always going to be a combination of what we choose to do as family and what we need to help out. But what we can do for caregiving is have policies that help relieve some of that care when we're not able, so that we don't always have to make a choice between, say, a paycheck and caring for someone, going in sick to work and caring for our relative, being able to sleep and caring for our relative. So we need to have built in policies that allow for breaks, allow for alternatives when we choose to have them there. And all of those things may not be a direct pay to the caregiver, but it provides more options for care for both the caregiver and the person they're caring for. We have paid family leave, for example, in California, but it's not protected leave. So, yes, you can go care for your relative. You can get maybe 75% of your salary, and the majority of people can't afford to just get 75% of your salary for 6 weeks or 8 weeks coming up. But if we have policies that maybe say, here's 100% of your salary while you're working, because most caregivers are working, but so that you can go care for your relative or set up something or get to that doctor's appointment when you need to, and your job is protected, meaning that your employer can't fire you for trying to help your relative. Those are, I think, important policies that need to be looked at and strengthened if they're not already in place for paid leave, paid sick leave, and different ways and flexibilities. We also find that for the unpaid family caregiver, for some caregivers, they do get paid very little. They might be getting paid through what's called in-home support services, and that's because their relative qualifies for. Because they're low income they reach the low income threshold, so the relative qualifies to have someone and they get to choose who they want to help them. The difference is if you're a family member and you're getting a little bit of pay to help your relative, at the same time, we know that the relative doesn't walk out the door after 24 hours, as opposed to somebody who's this is their job and their profession. It's usually the opposite. They've been taking care of their relative without even knowing that there was a benefit that they could possibly get a little bit of money, which then they usually turn around and give back to their relative in some way in terms of buying things, or they may have quit a job that paid more than what they'll ever, because it's usually around minimum wage for IHSS workers. So they may have left a higher earning job so that they could have at least some income. And remember, when they leave your job, that means you've left medical benefits. So it's not just paying the person. They're not going to necessarily have any kind of health care. They're not going to be saving for their own retirement. So most people, you're losing more than the person would ever be paid by if they receive payment for taking care of their relative.
What can we do to advocate for better protections and policies so that family caregivers can not lose their jobs or be putting in half time because they have someone to take care of? What can we do to offer better protections and policies?
Well, one thing is, first of all, family caregivers have to recognize that they are family caregivers. Anytime we've had a movement, say, for example, right now, Black Lives Matter, um, you have to identify with the group. Fortunately, with Black Lives Matter, it's not just African Americans and Black people that are uh, part of the movement now. It's what we call allies. And so more people are identifying with the issue. But family caregiving, surprisingly, most people don't even think of themselves they say, I'm a mother, I'm the daughter, I'm the son, I'm the spouse, but they don't put and I'm a caregiver. So first you have to self-identify as a caregiver because the issues are there. The issues for caregivers are I'm caring for my mother, but the policies aren't supporting how I work. I need to take time off to care for my relative, but the policy isn't there so that I have sick time to protect my relative. Even during COVID-19, people are having to choose between going to work and putting the person they're caring for at risk because they don't have enough paid sick time or they don't have protected time for work. Um, so once caregivers identify themselves, then you can ask for things like, if I'm caring for someone, um, can I be more eligible for respite? So that I can take a break and have somebody else come in for safety so that I can get a little more sleep, so that I can go to my own doctor's appointments, um, so that I can just enjoy a meal without interruption for a little while. You can look for policies that help with education so that you feel comfortable and confident in how you're helping the caregiver. More benefits around mental health because almost 50% of family caregivers express some form of depression, anxiety, and they could really have benefit from being with somebody who really understands caregiving, can talk to them and help them through with their depression, anxiety, being able to have enough support groups in their neighborhoods, having adult daycares, uh, all of those things that you can really advocate for. That comes from coming together as a group and speaking up to legislators. And, people get scared about talking to a legislator or their elected official, and they go, well, I don't know how to develop policies. Well, you know what? You don't have to come up with the policy and you don't have to come up with the wording. What you can do is tell your struggle, tell your story, tell not just the struggles, but also why you do what you do. And your story will be enough for the policymakers. They're the ones that need to understand where the gaps are and to understand what your needs are. And so when you tell your story, all you have to add is, and I wish that someone could do blah. Don't worry if it's there or not right now. You just give out your wish list. And that's what policymakers are supposed to respond to. So, talking to your elected official, um, even if there's not a bill right now, just calling and letting your elected official know, your local person, your person, and your congressional person, because there are policies going through at the state, local, and federal level that really do impact working caregivers, older adult caregivers, caregivers to persons with disabilities. And you have to tell your story. But caregivers tend to be very silent and very private. This is caregiving is like where we were with domestic violence and discussions around Black Lives Matter and racism. It's still what people consider a very personal issue. They don't want to talk about illness in their family.
Well, you make several great points there. I have a friend who's a legislator in the state of California, and he's always, whenever I talk to him, he says, "What is something? Give me something. I want to create another bill. You let me know what I can do for older adults." And he said, "I'll get it on the agenda." So the advice you're giving is absolutely correct. That these people who go into politics, for the most part, in my experience, do so they can help people, so that getting to them is really important, and they're more than willing to listen.
Right. Yeah, we could use health policies for caregivers. 23% of caregivers say that just by being a family caregiver, their health has been made worse. And why is that? Because they're taking their relative to the doctor, and they're not going to the doctor themselves for their own health care needs because they may not have time to do it. They have to make a choice. I can either get my relative who is sicker than I am to the doctor, or I can go to work. Or I can use my sick time for me. And so, having to make those kind of choices, that means that we really need to have better policies overall for long-term care services and supports in our communities.
Right. We've all, I would expect, I certainly have had acquaintances who have died before the person they were caring for because of the strain. It's very common, and it's something we really need to address.
Yeah. And again, that's often because we don't see ourselves separate and apart our role as a caregiver, needing what we call needing your oxygen, putting your oxygen on first. So if we don't care for ourselves, we're not going to be there in the long run to care for the person that we want to, but we tend not to want to put the oxygen on first.
What would you say if I were to ask you what can be done to mitigate this racial disparity that we see in the kind of assistance that family caregivers are getting?
George, this is such a timely question. The pandemic right now has really just removed that very thin veil that was covering up the health disparities and disparities in social determinants of health in our society right now. Racism has always pushed our African American, Black, Latino, and other ethnic and racial groups to the margins in terms of how we've set up policies to help them with family care overall. Even when the in-home support services was set up, part of that was that there were not reimbursements for being a caregiver in terms of benefits that you could pay into Social Security or things like that, so that people that worked in domestic work never could kind of build up equity for themselves, financial equity. And then when it comes to health disparities right now for the African American community, diseases like Alzheimer's are considerably higher among that population, and we're more at risk because of other health disparities. And that all comes down to the fact that we've had health policies that have not been equal, or access to health care has not been equal. And so our older adult population might be sicker than other populations. And during the time of COVID, that health disparities have just been shown through the fact that we have much higher rates of death and infection among the African American population. So, what can we do about this right now? I mean, first of all, this is a systemic issue. And if we don't look at social determinants of health, and what does that mean? What do I mean by the word social determinants of health? If we don't look at where people live, access to transportation, access to food, access to housing, access to adequate jobs, adequate income. All of those are social determinants of health because, it's kind of like being a psychologist, we learn about Maslow. And if we haven't taken care of people's basic needs, it's hard for us to thrive as human beings if you don't have your basic food, shelter, and taken care of. And so that's a lot has to do with where we have to start to help reverse the health disparities. And our healthcare system should be, in many ways, I think some of the funding needs to be redirected into those social determinants of health that allow for us to pay for food, to pay toward housing, adequate housing when someone is sick, to pay for transportation cost, all of the things that help you heal when you're not feeling well. You need all of those things available. And we have to look at, where people are living, and do we have enough medical facilities in a neighborhood? Do we have enough adult daycares and child care centers in neighborhoods? Do we have enough grocery stores in the neighborhood? And do we have the right types of food and fresh vegetables and things in the neighborhood?
Right. And one of the things that opposing thinking suggests is that we can't afford any of that. And so all of us have to be willing to take some share in the responsibility. for creating these programs and these subsidies that will make the lives of all of us better.
Hmm. And, when you say we can't afford, we're just, it's like what people are saying towards defund the police. It's not that people do not want police officers. It's this, let's make the work responsibilities of the police officers not necessarily, we can use some of that funding towards social services that decrease the need for police officers. So it's the same for our healthcare system. The more that we invest in our social programs, you won't have as much use of the healthcare system. So it's not that you have to suddenly find money, it's there. It's where we prioritize it and where we move it.
Donna, I wanted to ask you a question about dementia caregiving. I know from my research, the times that I've worked with the Alzheimer's Association, trying to research ways to make the burden that caregivers carry a little bit easier. What is your reaction to ways, at least policies, proposals to do something to make those lives easier so that they can, at the very least, survive the people they're taking care of?
For dementia caregivers, one of the reason that that's so especially challenging for us as family members is sometimes in the beginning we don't recognize that the person is having memory problems. There's a lack of consistent diagnosis for families, so that people they may just hear that somebody has dementia, which is this giant umbrella term for symptoms that include memory loss and thinking changes in thinking, sometimes changes in personality. But saying that an older adult has dementia is not enough. And so you actually need a real diagnosis to figure out what type of dementia. Is it Alzheimer's dementia? Is it Parkinson's dementia? Is it dementia related to someone who's had a stroke? And the reason that getting an adequate diagnosis is very important is it's just like if you have a flower. If you don't know it's an orchid versus a rose, you may give it the wrong water. You may not give it the right food, and you may put it in the sun in the wrong way. The same thing happens for dementia. If you don't know the difference between Alzheimer's dementia and, say, Parkinson's dementia, you have to have different medications, and you're going to have a different, the way the person's dementia will progress will actually look different for families. And so they need to set up legal things in the future. And so it just helps them understand how to care for that person in the long run, because these are very chronic diseases. So I think for dementia, the policies need to be there so that we get better diagnosis, that we have more physicians who are trained to recognize and help family members, that social service and physicians also know where to refer people to once they have a diagnosis of dementia, and how to help the family, because it's not going to be, the physician isn't going to be there to help with support groups. They're not going to become the support group person. They're not going to help them navigate other social services. But if they make the right referral to, say, an Alzheimer's Association or AARP or the California Caregiver Resource Center system, when you make that referral, that actually helps start the process so that the caregiver will have somebody who they can call whenever they need to over the course of many years. As the disease progresses, you're going to need different training, different information. And once they have the right link in the community, they'll have a buddy to stay with them throughout the time of what we call our care journey. So dementia really requires that because of the fact that it's chronic, and the fact that there are going to be periods when you seem like, oh, I've got this, I know what's going on, and then something changes and you need to have a new set of resources.
Wow, that's really telling. I remember reading something recently where the author said that even if the percent of dementia patients is reduced, the sheer numbers are going to increase exponentially because of the number of older adults that are going to be. So it's really something that we have to pay attention to and do something about starting now. We have a limited window of opportunity to take care of this issue.
Right. And we have to take care for both the person with dementia and for the caregiver, because the caregiver is going to be the person that steps in as a person's memory and abilities continue to decline. It's really that caregiver that has to step in the long run, and the responsibilities begin to become greater for them. So the support for the caregiver, separate and apart from the person with the dementia, becomes very critical. And right now, that's not something that we do very well. We do not assess the needs of the family caregiver apart from how they can help the person with dementia. But we don't necessarily look at the caregiver and say, let me understand how you're feeling emotionally. Let me understand how you're sleeping. Let me understand what do you do to take a break. Let me understand, what do you really understand about the disease or the progression? How are your finances? There are just a lot of questions that need to be asked of the family caregiver that's very different than saying, do you think you can feed your mom? That's, there's more to it than feeding mom.
Yeah, I mean, I was doing something with in-home aides and researched the requirements to become an in-home aide. And at one time, you only had to answer two questions. Have you ever thought about doing it? And have you ever done it for a family or a friend at least once? And that, right. And I mean, that was like absurd, but that's where we were at just 20 years ago.
A lot has not changed on that. And for family members, the coordination of care, sometimes people think, oh, well, if they have somebody else in their house helping their relative with the feeding and dressing, then they're not doing caregiving. And that could not be further from the truth, because coordinating and being the eyes and ears for another person takes a lot of energy. You're making decisions on behalf of that person. You're making sure that the other person is caring for your relative, right? You're the supervisor. And even if the person, if they go to assisted living or a nursing home, you still are involved in making decisions daily for that person. So that caregiving role stays throughout the life of the person you're caring for.
Well, okay, Donna, thank you so much. This has been a really interesting conversation and very informative. Thanks so much for joining me on this broadcast. It's been a great pleasure, and thank you so much. It's so wonderful for me to have a chance to talk to you in this way, because we run into each other in the halls of the school and we see each other.
Yeah.
But we very seldom do.
Well, not recently. We're not in the halls right now, but yes.
But this shall change, right?
This will change. It will. But yes, I don't get to talk to you about this very much. And thank you so much for giving me this opportunity. I hope that if anyone who listens to this will reach out to me if they have questions, and reach out to the caregiver centers that are around them. And there may be more questions that maybe we can answer at another podcast.
Sure, that would be great. Well, this wraps up this lesson in lifespan health. Thanks again to Dr. Donna Benton for her time and expertise, and to all of you for choosing to listen. Join us again, and please subscribe to our podcast at lifespanhealth.usc.edu. Lessons in Lifespan Health is supported in part by the Ney Center for Health Span Science.